Oje. I'll be one of your hosts today to kind of lead you on some information about American Business Systems. First of all, they've been in business for 26 years. This March, I believe it is, when they turn 27. So I guess we need to actually fix this because this year officially they'll be 27 years in business. So you're with somebody that has a little bit of longevity, kind of seen things come and go, seen a lot of business opportunities come and go over the years. Because everybody's asked us, should I invest in a sandwich shop? Should I invest in scraping bubble gum off the bottom of the tables at restaurants? Do I get into medical billing? Somewhere in between all that, I think we've seen it all. So, but ABS has been around for quite some time. You'll see this picture a little bit further down with some more added information to this that we're going to talk to you about all the different new opportunities that ABS has. And obviously the core center of everything that ABS has to deliver for you is the medical billing platform. And you can't do medical billing without a medical billing platform. And ours is a cloud-based system. There's nothing you have to load on your computer. So if you think about that from a security level, that is the best way you want to be able to have. You don't want to have anything residing on your computer. You want to have that offsite somewhere else. Everything is a software as a service nowadays. So you don't want to have to download software that's going to clog up your computer. You just log into it through a URL. You get to all the things you need to get to, especially all the patient information and graphics and their health records. You don't want that exposed on your personal computers. That's why you can run the system from an iPad. Obviously, iPads and Android tablets, they don't have hard drives. It would be too big for you to even download on there. But also, you don't want this data stored on those computers either. So our iClaim and EMRX platform is top. Again, you've seen this. You can see that we've added some more things to it. The telehealth industry. Actually, we need to add one more, which is called virtual care. We're going to kind of talk a little to you about that as we get started here. But without any further ado, let me introduce to you the co-host that will be with me this afternoon. He is the founder and the CEO of American Business Systems, and that's Patrick Phillips. Patrick is an author, award-winning author here. He's written several books, How to Reprogram Yourself for Success. It's been out for quite some time. You can find any of these books out on Amazon. We'll be talking a little bit about the new thriving medical practice, how that actually works for you in your favor. And then we will get into, he is also a ready author for Billing and Coding Advantage magazine, a member of the editorial board. And Patrick, listen, without any further ado, let's talk about healthcare. So let's bring you on and let's get started here.
All right, Eric, I'm just going to kind of focus right now on a little message to the people who are on this webinar today. Folks, thank you for showing up today. But I want you to know that, as our title says, it's the new year, right? So what business should you invest in if you're thinking about getting into business for yourself? And why do we suggest that healthcare is the business that you should get into? So, here's one way that I put it. I boil it down like this. As long as there's human beings, as long as human beings get sick and go to a doctor, the doctor needs to get paid for what they do for you, right? And somebody has to bill the insurance companies and the government agencies like Medicare to get the money to the doctor. And so you can be trained without any background or knowledge of coding or billing whatsoever, just like hundreds of people have in the past 26 years with our company. You can be trained to do that billing for the doctor and help them maximize their revenue. So if you're looking to break away, from your current job situation, or maybe they're going to break you away on their own and be your own boss. And if you're tired of somebody else telling you what to do, how long to do it and when you can take a vacation and how long you can stay, you're in the right place at the right time today, because maybe you just know that you have the ability to earn more than you're currently earning by working smarter, not harder. And you just haven't found the right business yet, the perfect vehicle, so to speak, to reach that higher income level that you're looking for. Well, pay attention, because for the next few minutes, Eric and I are going to tell you exactly how we at ABS have changed the lives of hundreds of people. I mean, literally from coast to coast, from every possible background and educational status. How? Well, we've trained people from every walk of life and helped them to fulfill their dream of becoming their own boss, actually owning their own company, not working for a doctor, not going to college and getting a degree in billing or coding. We can get you trained within 30 days and have you up and running with your first client shortly after that. So for just the next hour, silence your cell phone, close up that email that you're reading right now, turn off the TV or YouTube that you have running, put out your cat, and focus on what we have to tell you on this live webinar today. Just maybe you'll discover how you can make your dream come true too. Maybe you want to travel while you can still enjoy it. Maybe you want to, retire earlier than you had planned from your work business. Or maybe you want to put your children through college or help some of your loved ones financially. They're always asking for money anyway, right? Or perhaps you want to build that dream home by the lake or play more golf or spend more time with your kids or grandkids. Whatever it is that you are looking for, I'm here to tell you, you can achieve it by being in control of your destiny. Now, here's a little secret very few people know. 83% of all wealthy people in the United States got wealthy. Oh, let me say that out loud. I was whispering. It is a secret, but maybe you've heard this before. 83% of all wealthy people in the United States got wealthy with the thing that we're going to share with you on this webinar today. It has nothing to do with inheriting wealth because, well, first of all, most people don't have a rich aunt or uncle that they're going to inherit money from, right? And if they do, they're probably not their favorite niece or nephew. So they probably won't get anything more than a Starbucks gift card from them. And if you think you're lucky and will someday win the lottery, by the way, your chances of that happening are about as good as being struck by lightning in the same spot 7 times. It's just not going to happen. And unless you have the training and the education to be a professional, like a doctor or a lawyer, for example, your best bet is to do what that 83% of Americans did to build wealth. Are you ready? Here's what they did. They started and owned their own business. Now let that sink in for a minute. The secret to wealth is just start and own your own business. You know that your boss makes a whole lot more than you do, right? The people who own your company, that's because they are the owners. So you need to start thinking in terms of not being an employee, but an owner. And we can show you how to do that. Listen, I've started dozens of businesses over the past 50 years. I'm 70 years old, but the one business that helped me to make all my dreams come true for me and my family was the business that we're going to tell you about today. And it's helped hundreds of other people from coast to coast fulfill their dream of owning a business. It's a very niche business that you have probably heard of before, and maybe you never knew anyone personally that had made money with it. But here's how simple it is. You'll be helping medical providers in your area to collect more of the revenue that they've earned when they see patients. That's it. It's that simple. And we have graduates from our training that are bringing in over $1 million a year in revenue. Yes, I've interviewed some of them, and you can see those interviews on our YouTube channel. Now, here's what this business entails. You'll be accessing a cloud-based, award-winning software system, just like Eric just showed you, to submit those claims to the insurance companies and the government agencies to help the doctors get paid more and to get paid faster. They'll get paid a lot quicker, by the way, than what they're now using their own staff in their own office, because you see, you are going to have a motivation to collect that money for them and help them bring that in because you get a percentage of every dollar. That's right. You'll be able to charge a percentage. Now, you'll not only save the doctors money by outsourcing their billing to you, but you'll collect more money for them and collect it faster than any other company can in your area. That's because of our proprietary system we're going to talk about today. Now, today we're going to pull back the curtain on this little known business and tell you how you can get involved if you think it's right for you. Now, I'll tell you right now that this is not a business for everyone. Not everyone can follow directions. Not everyone can figure out how to market something like this to doctors. And not everybody wants to be involved in the healthcare industry. But for those who followed our instructions and followed our system that we've developed over the past 26 years, these are entrepreneurs that have gone through our proven training program and become what we call certified medical revenue managers. Not just medical billers, certified medical revenue managers. You're managing the revenue for these doctors. And they've built businesses that can bring them all they want out of life. I just hope that you're one of those people after you hear what me and Eric have to share with you today. All right, Eric, let's jump in and get started.
All right, let's go. Let me put this flash this back up over here. There we go. Okay, folks. Patrick and I are going to kind of go through a few articles here. Again, you can find all these articles over in the handouts. So if you'll look over in your GoToWebinar control panel, you can scroll down there, get to the handouts area. You'll see actually a couple of those. You can download both of those PDFs there, no problem. Obviously, this is reading March of 2020, Patrick. I mean, I think this is one of the ones that you found, and we're going to kind of go over, kind of do a quick little review of some of the information that we discovered last year, all the way up through some recent stuff that we're going to show you here in just a moment. But goodness, national health spending growth projected at 5.4% annually through 2028. That seems like there's a projection going in the right direction for a particular industry.
Yeah, and this article, by the way, came out in March, but that was right at the beginning of the pandemic. You saw Benjamin Franklin there with a mask on. So this is right at the start of this whole pandemic, folks. And look at this quote. As it has over the past several decades, healthcare spending is expected to grow on average more rapidly than the rest of the economy. Eric, healthcare, I think, is almost 20%, 19 point something percent of the entire gross domestic product.
Yeah,
so
absolutely.
If you're thinking about getting in a business that has a lot of potential to it, healthcare is certainly one of those. Travel is another one. It was big before the pandemic, but I wouldn't want to be in the travel or cruise industry right now.
No.
Entertainment, food, restaurants, those are all on hold right now, right? But healthcare just goes on because, well, people get sick.
Absolutely. Then 7 predictions for what lies ahead for health techs in 2021. This is just dated December 2014. Not 2014, December 14th, 2020. All right, consumers' expected levels around virtual and digital healthcare are also rising, and business processes will change to meet those expectations. Patrick, we've already kind of talked about virtual and digital healthcare just briefly. What do you know about that?
You know, it's happening so fast, Eric, it really is hard to keep up. Now, as a company, we always are ahead of the curve, as we're going to talk about today. We've already developed services that we can offer to doctors that are right on the leading edge. By the way, all these quotes are in those little, not that anybody can read those, but we put those down there at the bottom of these quotes so that when you download the handouts, you can enlarge them and see exactly where we got these quotes. This goes on to say reimbursements for virtual care. We're going to talk about that. Virtual care will likely be expanded through 2021 as a new hybrid model combining telehealth check-ins and in-person visits, which will become the norm. This is exciting, Eric. There's a lot of money in here for doctors when they get involved in this virtual care, isn't it?
There is no doubt about it. And folks, this is going to go beyond what you think of as maybe what you come to know as having these virtual visits. We're talking about virtual care. Even in this, it talks about the financial pressures of the pandemic has led many providers to reevaluate the overhead cost of managing their IT infrastructure on premise. And this is a leading shift to a cloud-based EHR platforms. Patrick, again, these are these key elements. If you're trying to think about what industry that you want to get in, what businesses you want to try to get involved with, if it's not a cloud-based platform, whether it's EHR, virtual care, whatever it might be, you're starting years in the rear instead of being on the front line.
Yes, if you're looking at any other company, for example, that might say that they can get you involved in medical billing, just ask them this one question, okay? Write this down. Here's the question you need to ask anybody that's trying to sell you a training package of any kind. Does your software come to me on a CD or a DVD? Now, I know you find that hard to believe, but there are companies who are still what we call server-based. You literally have to put that DVD or CD into your computer and install the software on your hard disk. Then all of the data from the doctor, all the patient data is on your hard disk. Now, Eric, that's very dangerous, isn't it?
Yes, yeah, absolutely. You do not want that data on your computer.
No,
not at all. Another article that again came out just a few weeks ago, how the right revenue cycle partner can address consumerism challenges. I mean, Patrick, again, you would think that we have written all of these articles here.
Yeah,
Once you
because
read,
that's what we do.
unbelievable.
Yeah, our business owners are what we call licensees. They partner with doctors, don't they? They're
Yes.
revenue cycle partners. And it says with a revenue cycle partner, practices can rely on advanced technology, if they have ours, and a larger staff who specializes in key areas such as billing and coding to determine where the gaps and opportunities exist to enhance their internal operations and maximize their reimbursement. Eric, why doctors would want to handle their own billing using their own staff, their own IT software, et cetera, it's beyond me, but many of them still do, of course, as you know. Now, a lot of the doctors that we sign up are already outsourcing their business, but they're using companies that are using old technology. So our licensees are able to take those doctors and show them, if they were using ours, how they can maximize, I mean, really maximize their reimbursement.
Absolutely. Now, Patrick, I think there was a video that you wanted to show here, and I don't know if you've got that uploaded on your side or it's on where I can get to it or not.
Well, if you pull down that little menu under show, it should be in there, Eric. I don't know. Maybe it didn't go in there.
Yeah, I don't see it. I think I see Keynote and Safari. It's the only thing that I see right there. That's why I was
Okay.
asking if you were, or if I change the presenter to you, would you be able to show it from there?
Let's try that. Yeah, I just changed it. Let's see if I can show my screen here. Does it come up under here? Preview, last pass, messages. No, I don't think so, Eric. No, I'm going to leave that to you.
Okay, let me see if I can get it back over on my side, and we'll just keep going. I think you wanted to show a little bit of video, but we can certainly show that in a little bit future webinar there. That's not a problem. But we were really talking about an online software as a service in the cloud base, where you can be anywhere as long as you have internet connection. And Patrick, in seriously, even if you got a hotspot on your phone, you can run this business going driving down the road if you needed to. If you had to do that, you could do it whatever. I know at one point, people used to have these internet satellite things. You don't even need to have that anymore because, your phone obviously creates its own hotspot. So, gosh, you just wherever you have your phone, you have internet connection, and you can obviously do any billing that you need to do from any laptop. Doesn't matter if it's an Apple product or a Microsoft product or whatever it might be. You can do the billing because you're getting your internet through the internet.
Yeah, it's just like logging in and doing your online banking. That's software behind the scenes that's running on the bank's servers in the cloud. And so ours is the same thing, except ours was designed specifically for using it on an iPad, for example, so the doctor can access his EMR, his electronic medical records, on his iPad while he's seeing the patient. And then all of that data, of course, goes directly into the system, which you have access to for the billing. So it's just a fantastic system, folks. If you haven't seen our software, the reason we don't have a lot of demos and things out there is because we want to go through this with you and answer all your questions. So just get back with the person who invited you to the webinar and say, hey, I want to see a live demo, and we'll take a 30 minutes, 45, whatever you want, and go through that with you and answer all your questions.
Yeah, absolutely. All right, so let's talk about the increased opportunities that ABS has for you and for their licensees. And obviously, you can see we've got iClaim EMRX, you got telehealth. Again, you're running out of room to put boxes, Patrick.
Yeah. We keep adding different services. Folks, these are all ancillary services, by the way. You don't have to offer any of these to your doctor. Well, besides iClaim, that's the billing, and EMRX if the doctor wants to use our electronic medical record system. But all these others we came up with because they're great ways to get in and talk to doctors about their billing when maybe they've got their billing done by their staff and they no, I don't want to change, but they might be interested in some of these services. So we'll talk about some of these.
Well, we've been talking about telemedicine, and again, the pandemic has just it's had to have doctors reevaluate how they do their medicine. Obviously, in the very beginning, there were so many lockdowns that people just couldn't get there. So what did they have to do? They had to turn to Zoom, or like what we're doing right now with GoToWebinar or GoToMeeting, to where they were able to still see their patients. Now, obviously, more doctors are opening up, but Patrick, I don't know about you. Just last week, I had to have a telehealth visit with one of my doctors, and it was
Yeah.
actually, I liked it. It was really really cool because I didn't have to get out of my house. I didn't have to go there just to do a quick little checkup. I was able to have that visit right here in my home. So believe me, this is the way of the future. I mean, telemedicine and where virtual care is going, there is no turning back at this point.
No, even past this COVID virus thing, Eric, doctors are learning how nice it is to be able to schedule some of these telemedicines and just sit at their desk. You know, they can have a cup of coffee or something while they're talking to you. It's more relaxed and it's more personal and intimate, because just like people are watching us right now on their computers live or on their phone or their iPad, it's just the same thing with the doctor. You meet with them and you're face to face with them. The only thing is the doctor can't touch you, which
Right.
I kind of like.
Yeah. Well, you've heard us talk about virtual care, and folks, this is the reason why we're getting to this point in the webinar today. And you can see where it says CCM and RPM. And CCM stands for Chronic Care Management and Remote Patient Monitoring. So using telehealth for a more effective continuum of care through, again, chronic care management and remote patient monitoring can improve outcomes, the patient experience, and your bottom line. Folks, this is what's happening, and this is how medical billing and virtual care and this continuum of care is starting to blend together. So
Right.
it's gone beyond telehealth, Patrick. It's gone beyond just having that visit right there. What if, you could, if you're having blood pressure problems, or let's say blood glucose problems, blood sugar problems, you're type 2 diabetic and you really need to monitor your blood sugar. How about having a device that you can utilize at home, and it automatically sends that data to your doctor. The doctor gets it. Anybody in your family gets it. So it's a great way to stay healthy together. And so that's what this whole thing is going towards. And we're going to show you over these next couple of slides how this plays in as a new service line here for American Business Systems. Patrick, that's what I'm saying. This alone probably could be worth the price of the license of itself,
Yeah.
because return on the investment working with one doctor really does bring a return on investment. It's just that great. So let's just get into it. I mean, so we've showed all these opportunities that you have, whether it's through iClaim or EMRX or any of the other services, but now you've added virtual care services. And look right here, you've got right here in the middle, chronic care management and remote patient monitoring. And you've got others here that we don't even have time to talk about today.
Doctors, when they first see this, Eric, of course, some of them are aware of some of these terms, but they don't know how to get involved in it because of the technology involved. And as you know,
Right.
Eric, we can even monitor patients remotely now using little devices that they have right there in their home to monitor their blood pressure, their glucose. All those things can be sent directly through this technology to the doctor or the nurse that's actually doing that visit with them. So they don't ever have to leave the house. This is great for older people or handicapped people, because now they don't have to worry about getting out of the house, getting dressed, getting in the car, go to the doctor, and having to sit there and wait sometimes for an hour. This is just the ideal way. I think it's the way of the future. Now, we can't do everything. Doctors still have to see patients for some things. If you break your arm, you're probably going to have to go into the ER and see a doctor personally. But other than that, a lot of this stuff here can be monitored remotely, and that is money. It's another source of revenue for the doctor, as you'll see here in a moment, folks. I'm talking a lot of money for some doctors.
Well, one of the areas, and I know a lot of people always ask, have asked you and the rest of the team here, whenever it gets down to medical billing, which are the best specialties to go after? Now, I'm going to tell you, whenever it comes down to remote patient monitoring, Here is one that we just found, November the 6th, just 30 days ago, written by this attorney. And this whole article is how remote patient monitoring is changing the practice of cardiology. Folks, number one, you want to do billing for a cardiologist. That's number one, because their reimbursements are much higher than they are for a general practitioner. However, you can also engage them with remote patient monitoring. You can go in, you can see this article, that information's there, but I want to get down to this part of the article. And it talks about a little bit way down in the article, it talks about RPM coverage, reimbursement, and cost. So just bear with me as I read this to you. It says cardiovascular disease costs our healthcare system more than any other disease category. Medicare and other insurance payers have expanded coverage for the remote patient monitoring of cardiovascular conditions to encourage adoption. So folks, do you see? We're in the beginning parts of this. So to encourage adoption of remote patient monitoring, not just improve patient health, but also the goal of lowering hospital admission rates and their associated costs. Medicare has been on the forefront, Medicare, to the pushing of RPM, incentivizing its use with an average provider reimbursement of about $120 per month, up to $210 per qualified patient for 2020. We're going to show you some numbers here that are just going to blow you away.
Yeah. Briefly, let me just say this, folks. If you think about it, and I know we're going to get into some dollars here in just a second, but if a doctor has even 400 patients, let's say, that's a low for a general practitioner probably, or a cardiologist even. If even half of those patients are on this, it's a monthly reimbursement of about $120 per month for every one of those patients. And as you'll see, that can be done, those visits can actually be done not by the doctor themselves, but one of their registered nurses or even associate doctors. They don't have to be an MD that does this for the doctor, and yet that revenue, it's going to mount up pretty fast.
So remember what Patrick called you. You're a certified medical revenue manager. You're not just a medical biller. And this all has to do with generating more income for that doctor. So let's talk about that. Again, here are the three things you need to be thinking about. There's enhanced care for the patient, better improved outcomes for the patient, and then obviously there's an increased revenue for the doctor. So it's actually, with this program for these doctors' offices, it's actually lowering the cost of healthcare across the board, because remember, Center of Medicare and Medicaid Services are pushing this. And so we're going to talk about the estimated impact for a doctor. So in this sense right here, normally we have a doctor, and this is really based upon not the cardiologist, this is based upon a general practitioner. So if a general practitioner has some patients that they're doing chronic care management on and remote patient monitoring, and this is a total increase of revenue per patient throughout the year. So $840 per patient. Now remember, a cardiologist can make $120 to maybe $200 and something a month on that. So that'd be well over $2,000 a year. So you can see what we've done here. Just adding 250 patients to this will bring in a total potential additional revenue of $210,000 on 250 patients. Now let that sink in. That's on top of what they're doing already. So imagine you could walk into a doctor's office today saying, hey doc, not only can I end up doing your medical billing, but I can also help you with your virtual care strategy. What that means is you're going to help them with chronic care management and remote patient monitoring, adding that into their practice. You're not even having to do that yourself, and the doctor doesn't have to do it themselves, as Patrick mentioned. And then show them the calculator that it's going to increase their revenue up to a minimum of $250,000 more per year on whatever else they're doing. Remember, they're not even having to do this. This is basically like money that they need to take care of their patients. Now, what does that turn out to you? On everything that you're doing per patient on a regular basis, you're making $12.50 on that patient. So you take $12.50 times 250 patients per month, you're making $3,250 a month. What that's going to do is that you've got times that times 12, you're making $37,500 a year, and you're not even doing these things still.
You don't even do anything. We call this mailbox money because folks, literally, you'll be able to go to your mailbox and get the check from our services that are paying you to offer this to doctors. Folks, this is, people are worried, Eric, about marketing to doctors. They think it's some kind of sales pitch that they're going to give.
Right.
Folks, if you think you'd have trouble selling popsicles in the Sahara Desert, then this probably isn't for you. But you know what? That's basically what you're doing, is talking to a doctor about increasing their revenue $210,000 a year. That will get their attention, believe me. And then, of course, that could lead right into you doing the billing for all this as well and making money on that end as well. But you literally don't do anything. Once you get this set up at the doctor, they have their own staff doing these remote patient monitoring through our technology, and you're just making that $12.50 just because you signed them up. That goes on forever.
Yeah, hopefully we've got your attention because this is good stuff for you. All right, so again, we've already talked about telehealth is driving a boom in digital communications. I mean, obviously we know everything that's happening through here. Now let's just talk again about just income potential here. And now this is going to strictly go on just basically on nothing on but medical billing. So I've got a little bit of a slow network connection here, Patrick. I'm not sure if I need to turn off my webcam or not. How's everything?
That is coming through. Let's just both turn off our webcam. They don't need to see our faces throughout this webinar, I guess. They can hear our voices. That might help. Yeah, that's probably what they call web traffic. Yeah.
Yes, absolutely. All right, so let's get into this. Let's talk, Patrick. I mean, I think most of the licensees, they're average at billing anywhere from 3 to 5 doctors, maybe up to 7 or 8 doctors. So we took a minimum number of about doing billing for 5 doctors. Now, do you want to tell them where they can get this calculator first before we move on from here?
Yes, if you just go to our website, which is at the bottom of all these slides, see it down there, absystems.com. Up at the top, you'll see a little link there that talks about the income. What's the income potential? And then you'll see this one as called the calculator. And so you'll just fill in these numbers yourself. Now we've got some numbers filled in already. I think these are the standard numbers, aren't they, Eric, that we have out there? But they're just numbers that you can change to any number that you want. If you think eventually you'd like to have 20 doctors, then put 20 there where that 5 is, and so forth. If you think maybe you won't charge 7%, but you'll charge 5% or 6%, just drop that in there. And the average claim amount is, for a general practitioner at least, is about $150 per visit. So anyway, when you put the submit button in there, look what you're making now.
Yeah, we're going to click on that, and that's $22,000 a month in income.
Yeah, that's $22,000 a month. Now, yes, you do have some expenses, remember, to run your business, but folks, that's a lot of money there. Even if you netted, 80% of that, let's say, it's still a lot of money. This is your gross income from 5 doctors. That's it. Folks, I've interviewed people on these webinars that have 100 doctors, some of them 20, 30, 40, 50 doctors. It just depends on how hard you want to work and whether you want to hire people to help you and that type of thing. So if you just want to manage it yourself, Eric, wouldn't you say the average person could manage 5 doctors themselves and do all the billing?
Yeah, they could. They absolutely could. But again, you can see your yearly gross income. Even if you hired a part-time person or maybe even a full-time person and paid them $60,000, $70,000 a year to help you out here, you're still doing extremely well. And then if you had all 5 of those doctors on remote patient monitoring, you're adding another $35,000 to $37,000 a year times 5 on top of that. So, we're not here to blow out the numbers. If you did nothing more than just doing remote patient monitoring and 1 doctor in billing, you're going to be very close to being over, close to a 6-figure income already. two doctors on billing and one doctor on remote patient monitoring, especially if you had a cardiologist, is going to put you way over a six-figure income. And so, Patrick, I know you spoke to everybody just personally just a moment ago, but for the investment of the 28,000, that's the investment for the licensee. If you just do your calculations properly, you're going to find out that you're going to get your ROI and should be able to get your ROI within the first year.
Yes, that's important that as you're looking at any business, folks, that you ask what kind of return on investment, ROI, can I get out of this business, and how quickly can I get it? Now, you may sign up your first doctor in the first 30 days. Some people take 60 days, 90 days. It doesn't matter, folks, because when you do get that first doctor, that revenue is going to come in every month after month after month as they see patients. And if you do a good job, those doctors will refer other doctors to you. So you may not have to do any marketing at all except for the first doctor. And we'll show you exactly how we've worked that out step by step.
Absolutely. All right, so now we're going to, Patrick, you mentioned, and I even mentioned, that we're going to train you and certify you as a medical revenue manager. You want to talk about this group, MIRMA, what's going on there? What does it mean to be a medical revenue manager?
Yeah, the Medical Revenue Management Association of America is the one that actually certifies our business owners, our licensees, as they go through the training. You will learn exactly what MIRMA has put together to qualify you as a medical revenue manager. And at the end of that training, you get certified as a medical revenue manager, and we actually give you a certificate that you can show and that has your name on it, that actually shows that you have gone through our training and have qualified for that. So without any background or training in any other way, we give you what you need from MIRMA.
Then you get to, you also have a certificate that you can obviously show doctors. You have the CMRM that can be put right after your name, and there's your certification right there.
Yeah, all of our licensees, you'll see this all over the internet for some of our licensees that put on their websites their name, comma, MRMA. In other words, they are a medical revenue manager. Now, by the way, Eric, I think we talked earlier about the webinars that we can, that we do. These webinars, of course, are just to educate people, but we also do webinars for you. Once you become a business owner, a licensee for ABS, we are going to give you access to our licensee support site, it's called. There's over 300 business documents on there that we've got for you, that we spent hundreds of thousands of dollars developing, over 100 hours of in-depth training after your initial 10 modules training, interviews with successful owners, other people who've bought our package. You can see interviews with them, weekly industry updates to keep you up to date on everything, ongoing training webinars. Yes, we train our licensees on an ongoing basis with no charge for this whatsoever. Access to our physician partner that we'll talk about, Dr. Vicki Rackner, and the use of her personalized books, and then the done for you webinars that I mentioned. Eric, this is to me one of the most exciting things we do for licensees, because we used to tell them, hey, do a webinar for your doctors and your office managers. Well, we decided that we would just develop the slide decks and the flyers, the marketing materials for this, and let them promote it. And we do those through HIPAA. I mean, through MIRMA, we actually do these webinars. They do them for our licensees. I think it's just a fantastic way to help people market.
Absolutely. This is one of the ones that we did. This is this example. You kind of to the left, at the bottom of that flyer, there's enough space there for you to put in your name, your contact information, but it also shows the where they need to sign up. So here you've got the web.
Eric, you're cutting out again. I mean, completely, you just disappeared.
Well, I think we're having a little bit of trouble here.
Well, I've got some storming happening outside my house here, so that may be what's happening out in your area there as well.
Certainly could be. Hopefully everybody can hear us okay. I'm sorry for a little bit of the technical difficulty there. If I need to, I might just need to dial in to make sure that I help get through this.
Yeah, okay, I'll let you know if you cut out again. All right, let's talk
Okay.
about that business partner, Dr. Vicky Ragnar, that I mentioned earlier, folks. We have associated with a doctor who is the knowledgeable person in the United States as to how to market to doctors. Now, here's why. She was a general surgeon, an MD, for many, many years, saw thousands of patients. And when she decided to semi-retire, she wondered, what am I going to do now? Well, she decided that people need help who are marketing things like, I don't know, anything from equipment to pharmaceuticals, insurance, and of course, when we ran across her, she didn't have anybody she was helping that does medical billing. So we said, would you partner with our business owners? So that's what she's done. One of her most recent books is The Myth of the Rich Doctor. And that myth of the rich doctor is one of her most popular subjects that she speaks on when she speaks to doctors groups around the country. That has a quote there, I think, on the next slide, Eric, where we show the picture there. Physicians in private practice give away from an average of 30% of their incomes when they do not follow up on rejected insurance claims. Outsourcing your medical billing could bring claim rejection rates to as low as 2 to 5%. This may be the fastest and easiest way to increase your cash flow. Now, that's right out of her book. And you can use this book and several others that she's written. I think there's a couple on the next slide, Eric, that show that I wrote one with her there on the left, The New Thriving Medical Practice. And then there's one on the right that we have just now coming out, 9 ways that physicians in private practice let money slip through their fingers. These are aimed at the doctor. And you can have these printed with your name on the front cover of these books as having written the foreword. Now, we've got a foreword that we've already written that you can just put your name at the end of it, or you can write your own, of course, if you want to take time to do that. And then you'll have your name on the front cover, the inside title page, and at the end of the foreword, you'll have all your contact information. So, folks, it's just a wonderful way. You get a number of these books, of course, with your package, your license fee, but then you can order more if you run out and you want more of them. And Eric, I think we're printing these now. These are paperback books, about 200 pages, for less than $4 a copy that are personalized like this. So it's
Absolutely.
great
That's
marketing.
that's a very inexpensive business card and a very effective business card.
Yeah. So you'll be partners with Dr. Vicky. She'll give you a letter of introduction. We'll show you how to mark these books up with little tabs like you see here and highlight pages that have quotes. So when the doctor gets the book, they don't have to read it. They'll flip to these tabs immediately. That's just a natural thing people would do. And when they open them up and see those quotes, they'll get interested in talking to you. We've had licensees send these books out in the mail to doctors that they wanted to do business with. And the doctors literally call them up and say, hey, I looked through your book and I'm interested. Come talk to me.
Absolutely.
Yeah.
And let's and if that's not all of everything else that we have, let's kind of start talking a little bit for the rest of the time that we have. We have about 15 more minutes left here, Patrick,
Okay.
about some just touching on based on some of our regular other services that we have right here.
You know, remember, folks, you offer these only if you want to, and they are what we call ancillary. That means that you don't have to offer them if you don't want to. But if you do, you of course make money on all of these services, and all of these services are done through our technology. You have very little to do with what's actually given to the doctor and provided to the doctors from some of these. So let's start with that first one there, Eric, and talk about that. I think it's the
Telehealth.
telehealth, isn't it?
Yep, absolutely. I mean, we've been already talking about virtual visits being, the new norm. This is driven by, again, the social distancing, and folks, as one of the standalone, services that we have here, it can be done. It can also be done in and through the iClaim platform. Patrick, you want to share a little bit about how that's actually, you already had that, prior to even COVID?
Yeah, this has been built into our system now for the past, I think, 6 years. We built in the telehealth so that part of our system, folks, is along with the electronic medical records, we have a patient portal. Maybe you've used something like that with your doctor, but we have that built into our system so that the patients for the doctor can log in and actually set up an appointment for telehealth with the doctor through our electronic medical record patient portal system. So it's already built in. Now, this is not the remote patient monitoring, of course, that we're talking about. That's a separate service that we have tied in with telehealth that allows the doctor to actually monitor and keep in track with those patients from their office and make that $210,000 a year we just mentioned.
Absolutely. Then you've got CodeWrite. CodeWrite is another service that is utilized for those that are a little bit skittish about, the medical codes and whatever everything's going on about medical codes. You don't have to be a medical coder to be a medical revenue manager.
That's right. People are worried about, oh, how much training do I have to have? And they've heard about these codes that are involved in medical billing. So they think they have to memorize thousands of codes or something like that. Folks, our codes are all built into our system. The doctors can actually choose the codes that they want right out of our system. You don't have to know anything about codes because it's built in, and the doctors are the ones who tell you which codes to put in for their billing. As you can see there from this flyer, you can improve the reimbursement rates for doctors up to 30% by making sure that they're not undercoding. Some doctors are afraid of Medicare being, fining them for overcoding. And so by looking at their codes that they're currently using, our certified medical coders can make sure they're not overcoding and save them a lot of money.
And then you, on top of that, you've got CodeWrite. On top of CodeWrite, you have AuditGuard. Now, AuditGuard is utilizing those same certified professional coders to actually do some audits of the doctors, what they've already done. Patrick was kind of saying, mentioned a little bit about whether the doctors are overcoding or undercoding. AuditGuard actually reviews those, makes sure that we get the information directly back to the doctor, and then obviously help them make sure that they stay out of trouble. I mean, that's what this whole thing is about AuditGuard. Patrick, let's talk about Quick Collect, and then we're going to get ready to kind of start talking about what people might need to do if there's any questions we need to kind of go over. But Quick Collect and some of these other recovery of lost profits.
Yeah, that's a good point, Eric. I don't see a lot of questions coming in right now, so I know we're just enthralling people here with what we're saying, but folks, remember that question box is for you to type in a question. This is a live webinar, at least right this moment. If you're watching a replay of it, of course, you're obviously watching a video of it, but this one today is live, and you can ask a question there and we'll address those questions, so just type them in. This is a great one, Eric, because as you know, most doctors don't collect but about half of all the money that's owed to them by patients. Now, there are some patients, of course, that don't have insurance. Even insurance doesn't pay everything. And so the patients are usually billed something. And the doctors sometimes just write that off at the end of the year. Believe me, they'd rather have that money. And rather than turn it over to a collection agency, they can use our Quick Collect service, which is an online cloud-based service that does all of that for them, drawing that money back out from the patients in a gentle way to not run them off. Because if you turn it over to a collection agency, patients get pretty upset about that.
Absolutely. And then ChoicePay gives patients that have extremely high deductibles, and now is a great time to start introducing this into the doctor's offices. This gives them a way to sort of pay this, not necessarily just over time, although it is over time, but it's just a little bit at a time so that they're not hit with just high deductibles right up at the first. And ChoicePay, and each of these services that Patrick has been sharing with you, each of these are, again, ways that you make residual income as well. So ChoicePay and all of these. And iDocs Now is one of the last ones I think we're going to be talking about here. Share a little bit about iDocs Now, Patrick.
Yeah, folks, you've seen all those files behind the doctor there in their office. Those are old patient files. Some of those patients they probably never see again, but others, of course, they have to keep them all on hand for a minimum of 7 years. That's the law. And so what we can do is free up that space in the doctor's office, completely put all of those online. Now, our electronic medical record system will let them scan in documents, of course, as they see patients going forward. But what about all those documents that are already there? We can scan those in, allows the doctor and their staff from any computer to scan, search, and retrieve those from our web-based HIPAA-compliant document management system. It's way more than just a Dropbox. This thing is just fantastic, folks. When you see a demo of this, you'll understand why doctors love this.
And then I thought that was the last one, but we got one more, which is Compliancy Guard. And folks, again, this is another way that you can help doctors really stay out of trouble. Remember, as a medical revenue manager, not only are you helping the doctor make sure that they get more, but obviously keep what they get. And the HIPAA compliancy is one of those quickest ways that if they are violating any of the HIPAA rules or laws or statutes, they could not only lose a little bit, they could lose their entire practice. So as you can see, all of these ancillary services that Patrick has kind of stepped you through this afternoon are the ones that are going to help you either A, get in the door. We got Rochelle's getting a question here. Are we going to get help as far as getting our first client? That is what we're doing here. You will not just go in as a medical biller, but as a medical revenue manager. So Rochelle, the training in which Patrick is about to share with you that you're going to get obviously teaches you on how to get your first client.
Yes, and folks, here's the thing. Even though we've covered this subject fairly fast today, remember we do these webinars every week. In fact, we have one coming up next week, why people fail in medical billing. Yes, some people fail, and we're going to tell you exactly why they fail too, and what you can do to make sure that you don't fail. So be sure and register for this. That link that you see right there, I think is in the question box. Let me see if I can paste that in there again. I think I just did. So it should show up in your question box, or if you're on a mobile device, it might be in your chat window or something like that. But you can go ahead and click that link and register right now for next week's to make sure you have a seat in there. And remember, if you can't attend it, it's okay. We always send out a link for a recording of that as well.
Patrick, talk to them about the money back guarantee, and then we're going to give them about 5 steps of what they're going to need to do to move forward.
Yeah, folks, this is real important. When you are investing in a franchise or a business opportunity, you don't really know what that business is all about unless you do a few things we're going to tell you here in a moment, such as talking to people who've actually gone through the training. But we even give a money back guarantee. Now, I don't know of another company that does this. And people ask, how do you stay in business offering a money back guarantee? Well, it's only because less than 1% of any of our people ask for a refund. And here's how it works. If you go through our training, within the first 30 days, you decide, you know what, I just don't like this at all. I'd like to get my money back. We will give you 100% of your license fee back. That $28,000 license fee, folks, is just an investment in seeing whether or not you really like this business. But we couldn't let you go through the training if you didn't pay the fee up front because, well, everybody would want to do that, right? And some people might not even have the funds. So we make sure that you have the funds to invest by having you invest them, but then guaranteeing that you can get those money back if you wanted to. Now, let me tell you those 5 steps. It's real simple. Number 1, you need to look over our downloadable research guide. Here's a picture of it. It's over 50 pages, by the way. This is not information that's on our website. So you have to ask your ABS rep. And there's our email at the bottom of this slide that you can, or the next slide, to go to and just ask, who is my ABS rep if you're not sure. If you go to the email that you got for this webinar, you'll probably see their name there too. So ask them for that. They'll send that to you. Then browse our YouTube channel. I mentioned that earlier. There it is right there. It's real simple, youtube.com/whyabs. Yeah, just go look at there. There's hundreds of videos that you can watch on there, previous webinars and interviews and things like that. So go check those out for sure. Then step number 3 is ask your ABS rep for an owner reference list. In other words, these are other folks who've gone through what you're going through. They've done their due diligence, they've gone through the training, and now they're running their own successful medical revenue business. And you can ask them all the questions you want. Some of our folks who just volunteer to take those phone calls to help people make a good decision. Then number 4 is ask for that live demo that we've mentioned a couple of times of our iClaim EMRx platform. In other words, if you want to see the software that you'll be using, see how easy it is to use and how friendly it is, just ask for that. We get online with you and just guide you through the software. You can ask all the questions you want. You can stop us and ask anything you want about that software. It's done through GoToMeeting, and so you'll have the same advantages that you have here today, listening to us live. There's an illustration of us doing one of those. And then last but not least, review the purchase agreement and the funding instructions. That's one of the steps you need to do, of course, but you also need to make sure that you schedule your training. I think we've got that next slide, has that on there, Eric. Schedule your first training session. Yeah, that training session, by the way, is done one-on-one. You're not in a class. You're not on there with other people like you are on this webinar today. There's dozens of people on this webinar, but with you going through the training, you'll be one-on-one with an instructor who's been certified and has actually been running their own medical revenue business for several years. Those are 10 modules of about 90 minutes each that you'll go through, and you can get through all of those modules. Some people have completed those, Eric, in 2 or 3 weeks. Within a month, for sure, you can get through all of that training, and then again, you'll be ready to go out and get your first client. So, Eric, let's leave that previous slide on the screen there while we answer some of the questions that have come up here. Folks, if you have to run already, we hope we see you on next week's webinar. We're right at the top of the hour here, but we've got a little time here, Eric, to answer a couple of those questions. One of them is from Rochelle, says, are we going to get help as far as getting our first clients? And if so, how? Well, Rochelle, we've actually mentioned one of those ways here on the webinar today. We do webinars for you. We show you how to market those webinars or advertise them to the office managers and the doctors in your area, and then they show up on the webinars, and we do that for you. We're partners with you in this. Remember, we make money on the back end as well as that front license fee, so we want to make sure that you are making as much money and signing up as many clients as you possibly can. Then we showed you the personalized books. Now, we can't go into the detail on how we teach you how to market and how we help you on this webinar, but we've done many of those webinars. Go to our YouTube channel and just put in, the word marketing or market, and we'll show you how we have taught people how to do that.
She also asked, what if the doctor doesn't have an EHR or an EMR system? Well, again, most doctors are going to have an EMR system. You're going to find very, very few doctors that do not have one. But in that training, one of the instructors is going to teach you how to work with that doctor and move them either to a brand new one, which would be the EMRX, or transfer them from their current EMR system over to the EMRX system. Again, you'll just get with your business rep that you're working with here, and that can certainly be explained while you're going through one of those live demos. So be sure to go through one of those live demos and bring that up there.
Yes. Prakash says, what and how much of the royalty does the medical revenue manager likely have to pay? Prakash, I think you're asking if there's a percentage or some kind of royalty like with a franchise. Let me make this clear, folks, that once you've paid the upfront license fee that we ask for people, that gives you the training and the lifetime support and all the access to our materials, that is a one-time fee. You never pay another penny directly to American Business Systems. So let that sink in for a minute. There is never any other charge for extra seats in the software or users. There's never any charge for training. There's never any charge for upgrades or codes or anything ever. All of those fees that are accessed by the doctor through our system are paid for by the practice itself. You don't ever pay us any additional fees at all, Prakash.
Yeah. Bless is asking a great question about virtual visits. So for the virtual visit, are there medical products to sell to the doctors and their patients, or would they have to have their medical products, like for the vital signs, blood pressure machines, to use at home to be loaded on the remote patient monitoring? Great question. They will have the doctors and the patients will get the devices, which are cellular enabled devices. So they're going to be separate devices. These are not devices that you will have to sell. These are coming from the doctor's office. They're procured through a DME company, but that's all being taken care of on the back end. So for your concern from just introducing the doctors to virtual visits and remote patient monitoring, you just got to get with the group that helps with that for ABS. They take care of everything 100%, soup to nuts.
Yeah, there's nothing else that you have to worry about or sell to a doctor about that. All right, well, Eric, there's all the questions. I think we got them all for now. Folks, if we miss one of yours or deleted it accidentally, then just be sure and get back with your ABS rep and they'll answer that. I answered a couple of them personally there to a couple of people, Eric. You see that.
Absolutely.
Okay, well, thanks again, Eric, for putting this together today. Good information. I hope people sign up for next week's so they can find out why people fail in this business.
Absolutely. Thanks so much, Patrick. Have a great day.
All right, you too, Bob, for now.
Thanks. Bye-bye.